Is echopraxia seen in children? Have you ever noticed a child mimicking another person's movements without even thinking about it? That behavior is known as echopraxia. It is the involuntary imitation or repetition of another person's actions. While it is often associated with various neurological and psychiatric disorders, many wonder if it is seen in children. Echopraxia is not a condition on its own. Rather, it is a symptom that can occur in several disorders. It is most commonly linked to conditions like schizophrenia, Tourette syndrome, and autism spectrum disorder. In children, echopraxia can indeed be observed, especially in the context of these disorders. For instance, in Tourette syndrome, which usually begins around the age of 7, echopraxia appears as complex motor tics. These tics involve automatic mimicry of gestures or movements. Children with Tourette syndrome may find themselves imitating others without any control over it. Echopraxia can also be present in children with autism spectrum disorder. While it is less common than echolalia, which is the repetition of words, it still occurs. In autism, echopraxia may relate to differences in how the brain processes imitation and social communication. Now, when it comes to schizophrenia, this condition is typically diagnosed in late adolescence or early adulthood. However, there are cases of early-onset schizophrenia in children and adolescents. In these instances, echopraxia can be part of the symptom profile. It is linked to disorganized behavior and impaired communication. Research suggests that about 30% of individuals with schizophrenia may exhibit echopraxia. When echopraxia appears in children, it can complicate social interactions and learning environments. The involuntary imitation of others' actions may lead to misunderstandings or awkward situations. It is important to differentiate echopraxia from normal social mimicry, which is a typical behavior in child development. In echopraxia, the imitation is persistent and involuntary, sometimes even including harmful or socially inappropriate actions. From the perspective of schizophrenia, echopraxia reflects underlying brain dysfunction that affects motor control and social behavior. If a child shows echopraxia alongside other symptoms like disorganized speech or behavior, it may indicate early signs of schizophrenia or related neuropsychiatric disorders. This situation calls for careful evaluation by a healthcare professional. In summary, echopraxia can indeed be seen in children, particularly those with Tourette syndrome, autism spectrum disorder, and, less commonly, early-onset schizophrenia. Recognizing echopraxia in children is essential for diagnosing and managing these conditions, as it can significantly impact their social functioning and communication skills.